This is one of my favorite and go-to stability and mobility exercises to improve your knee function, especially if you've had pain or discomfort in the knee or any kind of history of knee injuries or issues, whether they are past or present. So let's talk a little bit more about what makes this exercise so effective and so important. So in order to get a better understanding of what makes the exercise that I just showed you so valuable, we have to talk a little bit more about what's actually happening in the anatomy of the knee joint. So your knee joint is formed mainly by two large bones of your leg, your femur bone and your tibia or your shin bone, and it's where they meet. So your femur bone here, at the end of it, there's these two wheel-like projections that are called the condyles. You have one on the inside, which is known as the medial condyle of the femur, and one on the outside called the lateral condyle of the femur. These wheel-shaped structures are not symmetrical, so the medial side is actually larger than the lateral side. Now your tibia here, at the very top of it, there are these two plateaued kind of indentations also on the medial and lateral side, known as the medial tibial plateau and the lateral tibial plateau. So these condyles of the femur, the wheel-shaped structures, fit and articulate into the plateaus of the tibia. And because of the asymmetrical nature of the ends of these bones, there has to be a little bit of rotation that occurs at the knee joint in order for the wheels to kind of fit into place inside those plateaus. So this is what makes your knee joint really special. It's not just a hinge joint that simply extends and bends, but there's a rotational component. And this rotational mechanism is known as the screw home mechanism. So when you extend your leg, the tibia in an open chain position here, like when my foot is off the floor, has to externally rotate on the femur in order for that leg to lock in place. When I bend my knee, my tibia has to internally rotate on the femur in order to unlock the knee. So I have external rotation to extend the leg in my tibia, and then internal rotation to bend the knee. The same happens when you are in a closed chain situation. So you can think anytime you are standing upright or doing any kind of knee bending or squatting. But now we'll think about the femur as being the thing that's moving on the tibias. So to extend my legs, my femurs have to internally rotate, which is the same as my tibia externally rotating. So my femurs internally rotate when I extend my knees, and when I bend my knees, my femurs have to externally rotate. So if all that seems like way too confusing and complicated, it's all good. Just remember that your knee is not simply a hinge joint, like a door that would open and close on a hinge, but there's a rotational component that makes training rotation very vital in terms of having the most efficient knee mechanics that you can have. And for the knee to have good mechanics means that the knee will be able to transfer load and force throughout the entire leg and into your body. Because remember, the knee is kind of caught in the middle of what's happening at the foot and what's happening at the hip, because you have this attachment of the thigh and of the tibia where they meet in place. So with this exercise, we're working directly on that knee rotation. Squeezing a block between the knees, we are allowing the femurs to stay still or your thighs to stay still, so we can focus on what's happening down here at the tibia and how it's articulating with your femur. We have a glider underneath the foot to allow for smooth motion of the tibia in like a little circular fashion. So I externally rotate, turning my tibia out without my thigh moving, move forward a few inches, and then internally rotate and pull back in. And I continue that same motion in this direction a couple of times. And then I can reverse it. I can move out with internal rotation and then come back in with external rotation. So if you want to learn more movements like this and tools and tips and tricks to improve your knee function, strength, stability, mobility, and so much more, visit us at threesphysioga.com and check out our new knee program that will give you these tools and so much more.